This episode of The Bill and Callie Show is brought to you by Brown Insurance Group has been providing coverage to municipalities, companies, and individuals in the region for over 73 years. As a partner of the Keystone Insurers Group, we are able to offer an extensive line of insurance products and services, from commercial services including employee benefits and liability insurance, to personal services such as home, auto, watercraft, and motorcycle coverage. We are also committed to our community. We support many charities and events in the region. Our core values of care and integrity since the inception of Brown Insurance Group has made us one of Indiana's most respected and valued insurance agencies. To make an appointment with one of our experienced specialists, call our Highland Insurance office at 219-972-6060. Brown Insurance Group. Small town values, big time resources, going beyond expectations to protect you and yours.
The Bill and Kelly Show is recorded at Studio A at Executive Suite Squared in beautiful Hammond, Indiana. Now, here's Bill and Kelly. Hello, welcome to our show, and with us today we have Terry Quinn, who is coming to talk to us about regional health systems. Welcome to our show, Terry.
Thank you, Bill. Appreciate it.
And,
thank you.
Yeah, so, why don't you tell us a bit about yourself, where you're from, and then tell us about regional health systems.
Well, I was born at an early age. I've been waiting all day to deliver that line, by the way. But, no, I grew up on the south side of Chicago, and went through high school there.
Did you know Bad Leroy Brown?
Yeah, very well.
Okay,
yeah.
just checking.
Yeah, I beat him up a couple of times.
I thought so.
Okay, but anyway. And after high school, went to Purdue University in West Lafayette. And then from there, I went to Notre Dame. I have a law degree and an MBA from Notre Dame. And so my career has taken me in a lot of different directions. I've run a manufacturing business. I've practiced law in Chicago. I've been headed a trust department and wealth management. So I've done a lot of different things.
Wow. And so what landed you, you're on the board of regional
Yeah,
systems?
I'm on the board. I've been on the board for about 5 years, and currently I'm the chairman of the board.
Oh, wow, we got the big guy here.
No, that was the guy before me.
The grand poobah of regional health systems.
Well, actually, seriously, it's the people that are out there providing the services. As I probably already figured out, I joke a lot, and
you fit right in on that show.
That's right, but it's
many
fun.
people call our show a joke. So
I'll keep that in mind. But at the board meetings, they're like poker games. We're just shuffling papers around. It's the people that are out in the field providing the services. They're the real
heroes.
Heroes, to say the least. Yeah.
So tell us about regional health systems and what they do.
Regional health systems is probably, I'm pretty certain it's by far the largest non-for-profit organization in Northwest Indiana. And what a bit of its history, maybe go back about 30 years. There were two mental health organizations in Northwest Indiana. One was South Lake Mental Health, and the other is Tri-City Mental Health. And the CEO at the time of South Lake was a fellow by the name of Lee Strawhan, and a fellow by the name of Bob Crumweed was the CEO at Tri-City. And they knew each other very well. They got along very well, and they would go to conferences in Indianapolis and elsewhere together. And I'm not sure who, they probably both would take credit for it, but somewhere along the line, they realized that, wait a second, we have common administrative needs. We need to have a human resources department, we need to have an accounting department, and do all of the back office type of activities. And so what they did is they created a corporation called Geminus Corporation.
Okay, so you're associated with that group.
Well, they're a subsidiary of ours.
Okay.
That's what people don't realize.
No, I didn't
Geminus
either.
is well-known.
Mhm.
Regional health is not well-known, which is kind of a branding issue
Yeah.
we're working on. But Geminus started out as this back office, basically, whereby they can share those costs, and that enabled both South Lake and Tri-City to deploy more of their resources to the services and more efficiently handle the administrative part.
Very smart.
Well, what's evolved over the 30 years is Geminus has just blossomed into an enormous activities. That's known for the Head Start, Early Head Start
Right.
program, which we administer or we provide in Lake and Porter counties. But then we also provide training and consulting services throughout the entire state of Indiana. And so regional mental health, Geminus Corporation, but then also we have a primary care facilities known as regional health clinics, which we've got, we have 4 operating, and these are federally qualified health clinics. We have 4 that are up and running now, 1 in East Chicago, 2 in Hammond right now, 1 in Maryville, but we're going to have a 3rd one here in Hammond area, which is going to be at Purdue Northwest.
Oh, wonderful.
And right on the campus there at Purdue Northwest, which will service the students in the surrounding area.
I love that.
And so there's so sometimes people say, well, what's the connection between mental health on one side and early learning through Head Start on the other side? And looking at it from the early learning part of it, there's many benefits to interacting with a child before they are 5 years old and time to go to kindergarten. All kinds of statistics. They're far more likely to graduate from high school, to go on to college, to provide become wonderful citizens in the society. But then also on the flip side, if early, they're far less likely to have mental health issues. And as far as the primary health, it turns out that the expected life of somebody with a mental health is 25 years less than it is for somebody without that
Absolutely.
issue. And but then they also have trouble holding jobs, and so their budgets are strained. They're taking their medication is always a problem. I mean, so from on one side the early learning and health, a Head Start and early Head Start, and then the mental health, and it kind of merges in the primary care component.
Right.
And so this is how regional health systems and the subsidiaries that evolve into that program has going forward.
Now, not knowing much before you came here about regional health systems, do any of the facilities, are they in hospital care, or is there a hospital situation?
Yeah, part of it is an inpatient hospice, and that's in Maryville. There's actually
Right there on Taft.
right there on Taft, but I had a good friend of mine who would go by that twice a day going to and from work, and I mentioned regional. He said, "Where's that located?" And I said, "Well, it's on Taft. The main offices are on Taft Avenue." And he further said, "Where on Taft?" And I told him the address. And then, like I said, he drove by it every day, never even noticed it.
Didn't have a clue.
Well, and part of the reason is that it's set back from Taft Avenue.
It is.
Probably 200 feet. And there's trees and landscaping. Mm-hmm. So you really don't see the buildings back there
Right.
unless you're looking for them.
Right.
And that's kind of one of the factors with regional is that, I mentioned Bob Crumweed, when Geminus was formed and then this alliance occurred between South Lake and Tri-City, Lee Strawn continued to run South Lake and Bob Crumweed continued to run Tri-City, and they kind of all worked together. Then what happened is Lee retired, he's moved to Florida now, and that's when all of these activities kind of folded into the same legal entity. And so Bob Crumweed has been a CEO for over 30 years, and but the last 20 of which over the entire program. But and now he just recently retired. And
so regional has mental health facilities where you can go for counseling and things as well.
Counseling, substance abuse, treatment. So there's the entire spectrum we have. And by the way, if I give out any statistics here, let me kind of say this is how I recall them.
Right.
Yeah, we understand.
Yeah,
but as close as I
possibly can. If I don't know, I'll make it up. But
that's where the lawyers sign.
That's
exactly.
right.
Yeah.
But we have 5 or 6 psychiatrists on staff.
Right.
The head of our medical program is a psychiatrist. But then at the primary health care, we have general practitioner, MDs, we have dentists, we have, of course, a wide spectrum of nurses and so forth. So the medical side of the program is very very vibrant in that regard. But the Geminus portion of it has just blossomed into family services. We have a community partner program, which is a senior day location. I don't know.
Oh, wonderful.
Type of program.
Adult daycare type of
adult daycare.
Yeah,
Okay.
I know St. Paul's out in Valparaiso has one. But yeah, it's huge market because there's a number of adults that just refuse to go in. And
well, when I was taking care of my dad with Alzheimer's, it was nice to have a place where he could go and hang out with some people his own age, and it gave me maybe an hour to get away and do something and then come back and feel fresh again. And he's had interaction with some other people other than me or whatever. They're great programs.
But another part of our program, which I haven't touched on yet, is we have something like 8 residential facilities that run the spectrum of apartments that are made available to people, and they they have to qualify. Definitely independent living, but what it is they are federal grants that provide the funding for it, and these are folks who are on very limited income situations, and we're able to provide them with an apartment for about $500-600 a month or something that's affordable.
Wonderful.
And we have something like 6 or 7 of those locations. But then we also have a location we call Lake Park, which is located in Lake Station, that houses about 120 people who, frankly, and there's no charge there, because these are people that if it weren't for this facility, they'd be homeless. And so it's a
great program.
Yeah, so there's a wide spectrum, and I mentioned a moment ago that Bob Crumweed recently retired, and he gave us he gave us 20 months notice that he was retired.
Better than the 2 weeks notice you normally get.
And I jokingly said, well, can you be out in 20 days, Bob? And he said, okay. But at any rate, and so we did a nationwide search for a CO. And one of the first things we did is like I say, it gave us so much time to kind of put this all together. One of the first things we did is literally tried to find another organization in the country, like regional. And we were not able to find one. And not only with our own efforts, but also with, as we would talk to various people in their respective industries. I talk a lot to auditors. I mean, it seems like every week there's a group of auditors coming through one program or another. And I've asked them, can you tell me of anybody you've come across? Because usually with these auditors, they might be coming in and auditing, for example, the Head Start program. And then they're, what's all this mental health going on in these residential properties and so forth? And they're just amazed at how complex the organization is. And frankly, the bottom line was we could not find anybody that was exactly like us. There's many fine agencies that do some of what we do. But
nothing that encompasses everything you have.
And that's, I mean, regional, to those who have reason to try and check these things out, regional's become kind of on the cutting edge.
Yeah.
And there's now other organizations, and we're, you know, imitation is the highest form of flattery.
That's right.
That are trying to replicate, you know, what regional has done, because Bob Crumweed, who's a outstanding person. I mean, he's fun to be with, and he's got this enormous visionary ability, but he's as down to earth and.
Oh, that's lovely.
Yeah, he breeds bulldogs and. But played college football, so I don't mess with him too. And he just has this wonderful can-do and activity, and so I personally have served on something like 15 not-for-profit boards over the years. I'm on 3 right now, including regional. But and so one of the things I've been able to do involved there is where I see some synergy between an organization and regional. So regional is very open to partner with other non-for-profits to assist them in any way. I mean, and I will, over a broadcast list like this, I won't be specific, but I've been able to, for example, connect regional with other non-for-profits who, without being specific here, there was a non-for-profit who was struggling with one of their programs, and it was they just didn't have the resources to make it work. And I connected them with regional, and what's happened is regional's now entered into a management agreement with them.
Oh, great!
And their program is working now because of the
starting to blossom. Yes,
the regional.
That's great.
And so that's one of the reasons why I wanted to come in today to talk about regional. We're trying to get that word out. Not that we're trying to be, feeding our own egos or something. About
Show-offy.
Show-offy. Okay, I'll let you. But to be able to see this amazing organization is right in our backyard.
In our backyard, exactly.
And there's when we have other not-for-profits on, we find that so many of them, they're trying their best to provide services to the people of Northwest Indiana or beyond. And then a couple of them stumble upon that. And I know a couple of them have said that they would love to see a network of non-for-profits established to share resources to help each other out.
Right.
And the end thing would be to help people.
Exactly.
There's people that need to be fed. There's people that need to be cared for.
Housed.
Indigent people, housed. I just talked to someone that knew of a family yesterday that is struggling with the house that they're in, and they have various different financial problems, and there's need out there. In fact, all of them identify there's a need that they just can't meet.
Right.
Everything from food to housing, and they can only do so much because of the money that they have. And it seems to me between organizations is a valid effort.
Well, that's exactly right, Bill, and that's kind of the strategy that Geminus has evolved under, and but also we see enormous opportunities out there in needs.
Oh, sure.
And obviously, we need to be good stewards of our resources, and we can't be all things to all people, but where there's a fit, there's a way of improving the situation.
Right.
Now, are there sliding scales for the different things that you offer?
In what sense, Kelly?
Well, if somebody wanted to go to counseling, but they don't have insurance that would cover that, but they don't have a lot of money coming in, but they really need that assistance.
Yeah, and as a non-for-profit, the services are available, period.
Okay.
We have people who can figure out
How to get it paid for,
How to make it work.
And one thing that amazes me about the folks at Regional, I mean, all of our funding is, and one of the reasons why we're not well known, all of our funding is from federal and state grants, or insurance, Medicare, Medicaid, sometimes private insurance, sometimes personal, payments. But we have people who just know how to get somebody signed up on Medicaid and where to go, what to do,
And to help them.
To help them get through that.
All right.
process.
That's great, because I know, we always talk about, in fact, it's a political issue, but it's a real issue. The logistics is, the healthcare is, for some people, because they don't know that organizations exist where they can go when something goes wrong, they get infections, things go bad. But, this whole idea of providing affordable insurance is still out of reach, because that affordable insurance is not affordable.
Right.
And you're forced to have something, or else you'll get fined. You can't, because every time you do your taxes, you have to have your form to assure that you...
I have a policy through the state, and my affordable is $865 a month.
$865.
And that's out of reach for a lot of people.
And that's beyond many people.
Oh, exactly. Way out of reach.
So there are facilities for people who don't have any insurance at all because they can't afford it. They're living day to day, 2 jobs, and they're doing the best they can.
Right.
But their kids get sick or they get sick, there's places that they can go to be cared for.
Yeah.
So in a way, that's nice to know that there is a safety net for folks out there.
There's a safety net, and if it's not at Regional, we have people at Regional know where
to send them to.
Where to call.
Yeah.
Now, how do people find out what's available through Regional and things? Is there a Facebook page or a
They come to
website?
the Bill and Kelly show, and
Okay.
people find out about it.
Yes, but I mean, if somebody is at home right now and they're watching and they say, I want to find out more about it, where the locations are and all these things, is there a website, a Facebook page?
Well, I guess, and that's why, like I said, we're trying to get the word out to help that process.
Right.
Heretofore, it's been mainly word of mouth.
Sure.
And if you're lucky enough to know somebody who might know something about it, and it could be a social worker at a hospital, or it could be any number of people that would be able to maybe be aware of what's available.
Right.
But part of our effort is to try to increase the awareness of it, and it'll connect from there.
Sure.
Yeah, it seems to me, again, like a clearinghouse for information. Someone comes to, maybe there's an 800 number to call, or a local number they could call and say, look, I've got a kid that has 103 degree temperature. I can't take him to the emergency room because
I don't have insurance.
Yeah,
I
they
can't
own
afford it.
insurance, and when you don't pay hospitals, they don't take that very kindly.
And I think and most hospitals, I believe, Bill, they have programs themselves whereby if somebody comes in who cannot pay, they have a component of their service that there's a non-for-profit organization over here that has resources. But it's all a challenge to get the most out of the available resources.
Right.
The needs far exceed the resources. So it's a matter of allocating this as efficiently as you think you can.
Right.
Then there's the other problem of the indigent care, people who don't have that insurance. I mean, you do have the services available, but it's also, interesting to see if there's any way of balancing that load amongst facilities so that
Right.
one facility isn't having an unfair load put on
There's that
them.
aspect of it.
Yeah.
But also, as you were mentioning the insurance, which is a major part of it, another major part of it is transportation.
Sure.
Yeah.
Whereas if you've got that child who's running a fever and you need to get them to a hospital, but you may not have,
Car.
the
Yeah.
car. And one thing that, here again, people don't realize, well, there's all these little vans running around Northwest Indiana that say regional health systems on it.
Ah, yeah.
And so,
Accessible.
accessible.
Yeah.
Where if you can't get there, we will find a way to get you there.
Yeah, what a wonderful
Yeah.
organization.
So,
Yeah,
I'm.
it is.
As I mentioned, I've been involved in a lot of non-for-profits, and I love the model of non-for-profits in that, they identify a need and they build this structure to address that need. But what always is the challenge is how do you finance it?
Sure.
Bill.
And because at the end of the day, if your revenues are not exceeding your expenses,
That's
you're
right.
not going to last very long.
No.
You could have.
And you just come in with a big check out of your personal savings.
Absolutely,
account.
twice a week
Sure,
at
of
least,
course you
Bill.
do.
Yeah. We knew there was a solution.
That's right, yeah, right.
Oh,
But, yeah, so it's a marvelous organization.
Yes.
well, before I didn't mean to, hopefully didn't skim over this, but let's talk about your,
Used to that.
yeah.
And so when they hit a roadblock, instead of getting all frustrated and pounding their fist or something, they said, okay, we'll just figure out how to get around this, get through this. And
So is the organizational level such that, I mean, because, there's some people sitting out there that, getting ready to do taxes and they would like to have a write-off.
were you looking over my shoulder before I came over here?
No, believe me, I'm, oh boy, no, I wish I had something to contribute, but we got everything into the show. But no, what I was about to ask, is, do you accept private donations? Is there a methodology? Is there something on your website, like a
Well,
giving button, or?
Being in wealth management, I interact with a lot of people who are very well off. And it's wonderful to see when those people are also very generous. And here again, I'm not going to name names, but one of my clients is somebody who has been very successful in business, makes several $1 million a year, and he gives half of it away every year.
Don't mention my name.
I won't, Bill.
Okay.
Okay. Just write it out. But in knowing my involvement with regional, he said to me, well, I'd like to contribute to them. And my response to him was, I greatly appreciate that, but regional's doing fine the way they're structured.
That's
and,
what.
and there's many other organizations out there who are struggling, and your money would be better to donate to them.
So you were, the mechanisms inside regional to get those grants from the federal government and
Works so
local
well that you guys are good.
It's working well.
Right.
Yeah.
Now, that's not to say maybe we might expand into other areas.
Sure.
And of all the programs, and I think there's something like 70 of them all totaled, are they all, have a positive cash flow? No. But the organization is large enough to be able
As a whole.
to supplement it, and if one program just for whatever reason needs to be shut down, not only can we sustain it for a while, but the people affiliated with that program can be absorbed in one of the other programs.
Oh, that's wonderful.
But in the case I mentioned, if he wrote a check to regional, they would say, what do we do with this now?
No, there you go.
Kind of,
And so it's.
And they're not federally funded either. I mean,
No,
Right.
they're
or
privately
their
funded.
particular
They are
mission doesn't have
partially,
federal
but
grants.
they-
Right.
Yeah, but I get the sense that their federal grants don't cover their operational
Oh,
expense when
obviously
we've
not,
talked to
no.
them. And so then they're not large enough to sustain that, so they do have to go out and seek for private fund
Exactly.
or
Right.
companies to underwrite some of the things that they do.
And I've been involved with a number of them in their fundraising, whether it's a dinner, a golf outing, or both, or however.
Wine gala.
Yeah.
Or just making phone calls, sending out letters.
Probably that's why we like working with those smaller non-for-profits, because we get to go to galas and golf outing.
We get to dress up
Yeah, we
every
get to
once
get
in a
all
while.
swagged up.
Exactly.
And Kelly has to wear something other than a coffee t-shirt.
Coffee t-shirt,
Right.
which is my normal attire.
Look at our shows, every show for the last week, she's had a coffee
Oh,
t-shirt.
sure.
I have a Be Kind shirt that I wore.
Oh, that's
Oh,
right,
okay.
be kind.
Be kind to the coffee.
Be kind.
That's
There
right,
was
be
a
kind to
coffee
me
stain.
because I don't have a coffee
There
shirt.
was a coffee stain on that be kind.
Probably.
So,
You know, there may well come a time when we will need, or for certain programs, we will need to utilize that process. I'm not saying that's not going to happen.
Sure.
But it's.
But as of right now,
As
you're
of right
good.
now, and, you know, you may or may not know of Form 990s. Does that ring a bell
Yeah.
with someone? I mean,
Yeah.
every 501c3 organization has to file, you know, like our, talking about annual taxes, it's like their annual tax return. Now, they're not taxable, but they still have to report their revenues
they're
and
doing,
expenses and so forth. And so our 990s, understand why, but all these 990s are available, they're public information.
yeah.
And you can go on the internet and you can find from the very smallest to the very largest non-for-profit, you can find their 990
Yeah.
reports. But so if you were to go to the 990s for regional, you would find, because of the economies of scale, because of the way it's structured, financially it's strong. And has the ability to weather the ups and downs and some of the bureaucracy that you deal with, and that's what was so, you know, visionary about Crumweed and Lee Strawn to start building this organization to be in that. Because when they were initially independent mental health organizations, yeah, they were like every other non-for-profits, just struggling to get enough revenue to keep going the next 3 months or something.
Yeah, but Terry, we're going to have to start thinking about wrapping up.
Okay,
But we
right.
don't want to miss anything important that you want to tell
Well,
us.
I think I just wanted to help getting the word out about regional.
Yeah.
Well, let me give you a couple of phone numbers here. The result of our nationwide search is we found Bill Trowbridge, and ironically, right in our backyard. He's from
Oh, wow.
Valparaiso. But Bill has like 9 years experience as a CEO, and I've actually known him for 15 years, and he melds with our organization very well in terms of what he's done for smaller non-for-profits and has networked to build them into stable non-for-profits.
Right.
And so he brings that, you know, to regional now. He's been just almost to the day. In fact, yesterday was his second month anniversary.
Oh, wow.
Or whatever.
Month-anniversary or...
Yeah, I was thinking
I
the
hate
same
when
thing.
people say anniversary.
Anniversary,
because
that means annual.
Year,
That
yeah.
wasn't quite right.
Yeah.
That's-
Month-anniversary.
But at any rate,
Those are,
and all the feedback I'm getting from staff and others.
They like them.
Very much so. Yeah,
Yeah,
he's
cool.
His heart's in the right spot, and he's got an enormous brain. So.
And ironically, it's something that people don't realize, running a non-for-profit is more challenging than running a
Exactly.
a corporation.
yes.
There's other challenges that because you don't, your income base is going to be different all the time.
Different all the
and
time.
And so it's a challenge to fund all these people you have to keep employed.
And you're not really meeting your mission if your fees are too high, that
Right.
People can't afford it, you're you can't be too profitable. I mean, non-for-profit's actually a misnomer. It's non-taxable, but you still need to, the ability to kind of expand the services and to hit that right level where you can be stable and continue and consistent in what you're doing, but not, but at the end of the day, it's how many people you're serving.
Right.
Right. It's a balancing act.
It's a balancing act.
Yeah.
It's a challenge, and that unfortunately the vast majority of non-for-profits that I'm familiar with are struggling.
Well, we're going to get the information out about how to contact you, and and we'll try to get as much graphics out there as possible and phone numbers, because this sounds great. I mean, again, as you said, it's not very well known.
Right.
You're one of the largest not very well-known organizations.
That's right, exactly.
So, well, that's a crowd.
Change that.
Yeah, so, yeah,
Sounds great.
we definitely will. Well, listen, thanks for stopping by.
Thank you,
We
Terry.
appreciate
Thank you,
you
Bill.
being on the Bill and Kelly Show.
Always good to see you.
Absolutely, good to see
And,
you.
boy, thanks for the information,
Yes,
and
thank
keep the
you.
great work going.
We'll do our best.
Wonderful.
Great.
Okay.
And with that, we better wrap up and say
Okay.
goodbye for now.
Bye, everybody.
Bye.
This episode of The Bill and Callie Show is brought to you by Brown Insurance Group has been providing coverage to municipalities, companies, and individuals in the region for over 73 years. As a partner of the Keystone Insurers Group, we are able to offer an extensive line of insurance products and services, from commercial services including employee benefits and liability insurance, to personal services such as home, auto, watercraft, and motorcycle coverage. We are also committed to our community. We support many charities and events in the region. Our core values of care and integrity since the inception of Brown Insurance Group has made us one of Indiana's most respected and valued insurance agencies. To make an appointment with one of our experienced specialists, call our Highland Insurance office at 219-972-6060. Brown Insurance Group. Small town values, big time resources, going beyond expectations to protect you and yours.